Hi, everybody. This is Karen Henken, and I'm a professor of practice at the Kroc School at the University of San Diego. And I'm very excited to see you all here today, or to know that you're all here today. And I hope I can share some of the learnings that I have about design thinking and how this could be a highly impactful opportunity for you and your organizations. Next slide. So what is design thinking? Design thinking is a creative problem-solving approach where we design solutions starting with people's needs and desires. It's very different from what many of us see in designing solutions, whether it's in nonprofits or for-profits, where my experience, I spent 20 years in Silicon Valley. An example is there were tech companies that designed products having no idea what customers would really want, could perhaps spend millions, if not tens of millions of dollars, and then find out that it wasn't a product that anybody needs at all. Whether you're a Google spending $50 million that gets wasted, or you're a $100,000 nonprofit where you're spending $10,000 on a program or solution or service that nobody wants, it's the same impact. It's really, really critical to think about what are your users' needs when you start to design solutions, and how do you understand that? We're going to talk more about that today. Next slide, please. So what is design thinking? Design thinking is really moving from the idea of designing a solution as an individual, thinking about the product, and this is an example of where engineering meets art. But the most important change from design to design thinking is working in teams, to have multidisciplinary teams. For example, you might have somebody in the case of designing a product where you have an engineer and you have a graphic designer and you have a psychologist and you have somebody who really understands user experience. In the nonprofit setting, it might be having a caseworker and having somebody who does program management and somebody who does the finance side, and having them all work together to understand the elements of how those might come together to create the best impact for your clients or users. Thinking about experiences, how are people going to interact with your product or service? Really thinking about that from the user's point of view, and thinking about the intersection of what is the technology, meaning what is the solution? What is the business? Is this a viable solution? And what is the human element, the human experience that could go with this? Next slide, please. One of my favorite books, and an author who I heard speak last year actually at the Classy Collaborative, many of you might actually be Classy users here, was Ann-Mei Chang. She was actually an engineer, senior engineering executive in the likes of Intel and Google, and then went on to work for USAID and Mercy Corps and others. So really, I'm coming from the point of view of designing products with users in mind. And her biggest statement was, fall in love with the problem, not your solution. We all tend to try to jump to the solution too quickly without understanding the problem from the first place. Next slide, please. I love this when I saw this. Einstein has many, many incredible moments to share with us, and this was one that I thought was particularly pertinent. If I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. So we all need to have that in mind when we start to develop a solution and not jump right to the solution. Think much more deeply about the problem. Next slide, please. I'm wondering how many of you are familiar with design thinking. It is something that has evolved over the last many years. It's become more and more prevalent. It actually started in the world of not social impact, but actually in the technology world. For those of you who are Apple users and have a mouse, it was actually developed originally through David Kelly and his partner Tim Brown with an organization now called IDEO, when they were thinking about how Apple could create better interface with users. And one of the first things they came up with was a mouse. How can the user more interactively experience a computer in a less technical way? So that was the foundation of design thinking. It evolved to these 5 steps, which many of you have probably seen: empathize, define, ideate, prototype, and test. And it went on to become part of what is the D School at Stanford, which teaches people from all over the world and also students about the process of design thinking to create greater social impact. Next slide, please. The truth is that this is not a multi-linked process. It can be very iterative. While this is showing step by step, it actually can be really messy, and you can start with empathy, which is learning about the audience for whom you're designing, going to the idea of define. How do you focus your questions to get empathy to work for you? How can you get input from your prospective user, client, stakeholders, etc.? And oftentimes you start with empathy, trying to ask questions, trying to understand the story, go to define, and you go right back again because you realize you didn't have the right questions to ask. You weren't approaching this in the right way. And then you'll continue on to ideate, which is brainstorming, coming up with lots of ideas. The idea isn't to come up with one or two, but to come up with at least 10 of them, and then go out and start to test them, creating really inexpensive, rapid, low-cost, low-tech prototypes that you can go and test with prospective users, whether they be your beneficiaries, whether they be funders, whether they be potential stakeholders in a variety of ways. And then you go out and test it. And oftentimes at any step of the way, you're going to have to go back to the beginning, because you'll find as you're gathering more information in a very open-minded way that you don't have the right information, that you maybe made some assumptions that you need to continue to test, retest, refine, so that at the end of this, when you go out to test, you're actually testing a product that will start to resonate with the audience for whom you are creating this. Next slide, please. So one of the reasons we're all gathered here today in the Nonprofit Academy is because all of us have been impacted by COVID, whether we've been sitting in our houses for the last 3+ months, whether we've been on the front lines working in food banks, working in medical facilities, working in housing crisis arenas. It has disrupted everything. It also has disrupted everything we thought we knew about how to create solutions for our users. So we have a lot of questions. I always think, for those of you who are Wizard of Oz fans, and I remember the scarecrow going, he went that way. What are we defining? Who are we defining it for? Why? How? And how do we know which way to go? Because there's been such massive disruption that we often are starting from the very beginning to think about what is the best way that we can serve our clients, our funders, our stakeholders. So where do you want to go, and how do you get to your goal? It's a whole new world. Next slide, please. So one of the things that's really critical is that you, as a nonprofit leader, need to think about what are the most pressing problems you now face. What you thought you knew as the most pressing problems may be very different now, 3 months into this. What you thought was going to be the most pressing problem in the beginning of April could be different now in the middle of June. So how do you identify that problem? Creative thinking is critical for that, and that's where design thinking comes in. Next slide, please. So I'm going to go back to the beginning again. Design thinking, a creative problem-solving approach where we design solutions starting with people's needs and desires. Let's put that in COVID-19 terms. What is the most pressing problem you or your clients now face? How can you best meet your clients' needs where they're at today? And again, it's so important to think that what you believed were your clients' most pressing problems pre-COVID may be very, very different from where they are today. So being open-minded, being creative, being receptive to new ideas, and being willing to adapt and pivot are what we're going to dive a little bit more deeply into going forward. Next slide, please. So this graphic of the design thinking process is more what really is in mind. So we start with empathizing, which is who are you designing this problem for? Who are you solving for? Start with that. Don't even make assumptions about that. And then you go on to what? What are their needs? How can you solve them? How can you test them? And very likely, you will go back to some element of this or start at the very beginning. And finally, how do you tell that story? How do you tell your story so a user, a beneficiary, a client will choose you? There's always a choice. Don't do or don't use your products. Why would a funder choose you? Why would a partner choose you? So the storytelling piece is critical as well, but you have to think about all the other elements really carefully. Next slide, please. When I teach design thinking, and based on what I showed you earlier of the An-Mei Chang Lean Impact, which is do not fall in love with the solution, start with the problem. You cannot jump to the solution first. It's really our nature. We want to problem solve. We want to fix things. We want to come up with an answer as quickly as possible. But especially in a time of such massive disruption, you need to learn about and use the tools so you can understand the problem first before you start building the solution. If not, you might miss the mark altogether. You might waste funding. You might waste money. You might waste time. You might waste resources of your precious staff time. So take the point of view of the user. What do they really need? Why would they choose to use your product or service or not? And how can you learn more about that? Work in teams, get multiple points of view to get to those answers. Test your ideas, iterate, prototype, refine, and keep testing. So the idea is that you can create an appropriate and maximally impactful product together with the community. There's a lot of learning with that has to go on, not learning to, not learning at, learning from, is learning with. Learn from the community that you're serving. Next slide, please. I'm not much of a basketball player, but if you are going to be adapting and pivoting in these times, how can you and your organization learn to pivot, and how must you pivot in order to better address and better come up with solutions that will really serve the needs of your client in today's times? Next slide, please. So I wanted to share with you a few examples. These came out in the very early days of our pandemic and shutting down. For those of you who know Louis Vuitton, I don't know who has a Louis Vuitton bag or not, but certainly we all know them as one of the most luxurious brands and perhaps prestigious brands in the world. And they actually completely flipped one of their perfume factories to produce hand sanitizer in a time when we could not get enough hand sanitizer out there. As you all likely know, the supply chain that produced a lot of our PPE, our personal protective equipment, cleaning and hygiene equipment and products were broken. We could not produce enough. So Louis Vuitton turned around and turned over their factory. At the same time, a really interesting restaurant chain in Los Angeles, I don't know if any of you have been to Every Table, but they had a pay what you can model of small, local, healthy food restaurants around the city. And when they could no longer keep those restaurants open, they turned around and started doing mass production for low-income, hunger-insecure people and delivering them to their doors. They ended up partnering with the city of city of Los Angeles. They got a very significant grant. They rented out a large kitchen space to do that, and they pivoted literally on a moment's notice to be able to serve the community better. Next page, please. One of the things that's an unlikely partnership is Apple and Google. They are typically arch enemies. And instead, they came together to start to create tracing systems for COVID-19. So unlikely partnerships cannot come out of pandemics and disasters as well, which is good to know that business can turn around and address social needs. The same thing with Dyson. For those of you who are vacuum users, and I assume everybody is, and I know many of you probably have a Dyson vacuum, Dyson turned around and in 10 days created a new ventilator using their vacuum production facilities, with the intent of making 15,000 of them for the pandemic fight for needing ventilators. It turned out that they didn't even get to make all of those because the need was not as great as anticipated in some places, but they turned around and made that available. Next slide, please. Another indication of things that happen that are actually good coming out of this are corporate philanthropy, where corporate philanthropy has often been a smaller part of the total philanthropic pie, is actually growing exponentially now. Companies have been stepping up in massive ways to provide funding for a wide variety of needs, and it's been incredibly inspiring. So corporate foundations have become a much bigger part of the philanthropic pie and very influential in this. And then many of you might have seen some of the significant and generous donations. Jack Dorsey, the founder of Twitter, and Square dedicated $1 billion to COVID relief as well. So some really good things are coming out of businesses doing well and businesses partnering with philanthropy. Next slide, please. Other things, for those of you, and I'm sure there are many of you in this room who were planning on galas and other kinds of fundraising activities where you bring people together, because that's part of the beauty of it. You probably had to cancel those. Minimally, you had to reschedule them. And then you had to think about, what do we do next? So this is an example of Meals on Wheels in Evanston, Illinois, that turned around and did a gala. And the picture of the person in the tux is actually one of my longtime colleagues and friends, Robert Egger, who was one of the founding people in the social entrepreneurship space. He was a founding board member of Kitchens for Good, where I've served on the board for many years. He founded DC Central Kitchen, LA Kitchen, and is a leader in the food and social entrepreneurship space. Another example of another organization, Hands of Peace, that does work with youth, bringing them together across different cultural divides, Palestinian, American, and Israeli youth, and doing online learning conversations, because again, their gala had to be online as well. Next slide. So bring it closer to home, I wanted to share with you 2 examples of where some of these pivoting events are happening. Kitchens for Good, where again, I've been on their board since they started now over 5 years ago, had been a very, very successful social enterprise where they used culinary job training to train people who were primarily justice involved, many of them incarcerated, on-site, very hands-on culinary job training. And a very large part of their success and their growth came from a very well-established and highly successful catering and events business. They had a large space at the Jacobs Center for Neighborhood Innovation. Many of you might have been there. They did large events there, as well as obviously in home catering and so forth. All of the catering business disappeared essentially overnight. And they said, what can we do? And they turned to focus on hunger relief. And we're going to talk more in detail about that later on, because I'm going to go give you that as one case study. But that is an example of pivoting literally on the spot as demand was a necessity for learning and reinventing yourself. Next slide, please. For all those of us who have been to the San Diego Convention Center for one reason or another, events, conferences, etc., as that space was no longer able to be used, our city officials turned around and said, what can we do with this? And they turned it into Operation Shelter. As you all probably know, we have one of the highest homelessness rates in the country here. COVID-19 greatly impacted the homeless community in more ways than many others. And so the convention center opened up its space, put in socially distanced beds, they provide food, and they have become a major center for sheltering homeless during the COVID-19. And that is actually opening up many doors to other kinds of more permanent shelter that the city of San Diego has realized is critical to address. So sometimes crisis leads to necessity and really rethinking what our priorities are in our city. So addressing homelessness in a more thoughtful and comprehensive way is one of the things that's going to come out of this. Next slide. So in order to pivot and adapt, you have to start with a state of mind. I don't know where all of you were at the beginning of COVID and where you are now, but certainly uncertainty was one of the greatest things we all experienced, whether it was, can I make payroll? Am I going to be paid? Can I continue to offer the services? What is the state of the community? What is the state of the people we want to serve? Many of you probably went through and perhaps still go through some kind of grieving, and that's extremely natural and expected. And we had to all change our expectations. How the world is going to work now and what's going to happen in the future. What should our plans and visions be? So given that, we must all think, what is the most pressing problem you face now, and for whom must you solve this? You really need to rethink how you go out to the community you serve and get their perspective. And even if you can't do it in person, do it by phone, Do it in a way that creates some kind of interaction and creates feedback. But think about what is the most pressing problem you face now, and you may need to really reprioritize and not be able to address all of them. So where are you going to focus, and for whom are you going to solve this? So how can you pivot and adapt? How can you enhance and refocus what you're doing based on the needs and future directions that you see around you in the community? Next slide. So when we all started this program, when we all started our shelter in place, rather, we had a sense of perhaps grief, crisis, what are we going to do? And also perhaps hopelessness, because we saw a lot of funding sources disappear. We saw a lot of programs that were perhaps moving forward be halted. And yet other things started to become more available. There are new sources of funding. The funding that was created in the city of San Diego, now over $11 million, that is being administered by the San Diego Foundation, and with incredible and generous donations, especially from corporate donors in San Diego. That happened so quickly, and it was a brand new set of funding that had never been there before. Many other leaders are stepping up, whether it's SEMPRA and SDG&E. United Way, I know, has received many new forms of funding. The state, federal, as well as private donors and corporate donors. So there are new sources of funding out there, and you have to believe and you have to hope. So how can you become a leader and take control as we pivot? Just remember, while fear is rampant among all of us, it's resulting in many organizations sitting on the sidelines. So if you show up, you ask what's needed, and you demonstrate your value now, you are going to actually have a competitive advantage and rise above it and show that you have significant value to add in the community. The other thing is that many funders and other key contacts who might be so busy you can't usually access them are now sitting at home, more likely to be available because they're in front of their computer and they're in their home. And so they might be a lot more responsive than in previous times. So just remember, the whole world is going through this upheaval, trauma, and change. So show how you can be an asset and where you can add value. Next slide. So start with, how can you ensure you're meeting the needs of your customers and clients where they are today? That is really core to what design thinking is about, is how can you think about the needs of your clients, your beneficiaries, your stakeholders, your partners and funders. How has it changed? What are their needs today? Whether it's a funder needing to demonstrate a different way of creating an impact, whether it's clients who now are facing homelessness that they never had faced before, food insecurity, domestic violence is growing, whether it's the fact that schools have closed and parents have to work from home and also take care of their kids. Where are your clients and customers and beneficiaries today, and how can you best meet their needs? And how do you identify what those needs are? And then as you think about creating some new solutions or revising the solutions you already have, how do you make sure they're relevant and necessary? Because what was really relevant and very spot on for a solution in January or February may no longer be at the top of the pyramid of needs today. And then how do you differentiate yourself? So I wanted to pause for a minute and see if there are some questions that have come up on the chat or any other place. And if not, we can move on, and there'll be plenty of time at the end. But I didn't know if there are any questions that have come up right now. Monica, I see a message from you. Monica Ball is somebody I've worked with the funders together to end homelessness. Great. Coastal Roots Farm is on the call. Any questions at this point? If not, we'll certainly open it up at the end, and there'll be plenty of time. Usually when I do this, by the way, this is a new format, and we're all facing how to do things in virtual. I do super interactive workshops with people. And by the way, I also will tell you that I love nothing more than to work with organizations to help them figure out how to use some of these tools to redesign, to move forward, to be most impactful. Any suggestions for how to best measure and assess needs in the community? This is from Dustin. Dustin, I don't know what organization you work with, but you need to have a set of metrics to determine who you're working with and what makes a difference for them. For example, if it's food insecurity, is it something as simple as, and it's not simple, but is it, how many people have you fed? An example is, in the city of San Diego, we have a huge number of kids who are on Title I, free and reduced lunch. That availability has been extremely reduced. And so, okay, Dustin, you're with Outdoor Outreach. Great. Awesome organization. My students actually did a project with you 2 years ago. So you have a need where you're working with low-income kids, low-income young people, where the outdoors and leadership skills are transformative for them. So is there a way that you can continue to provide that? We're still in lockdown, so is there a way you can provide tools to help continue to inspire them, to provide the leadership training, the mindset shift that you do by taking them on these awesome hikes and kayaking and all kinds of outdoor stuff that Outdoor Outreach does? Can you help recreate that today? And what are your measures for creating that impact and solution, given you have a very different kind of solution you have to deal with today, right? You're not able to go do all the things you do outside that we know being outdoors changes mindsets. So what are the mindset shifts you're looking for, and how can you measure those, whether it's understanding empathy, self-confidence? Those, you have a lot of qualitative factors that you're dealing with. So I would think about that, and what are those measures that you're trying to continue to try to support and inspire in the population you're serving, especially given that a lot of the things you do have been taken away, at least until they open up more outdoors. Any other questions? Okay, let's move on. Next slide, please. Empathy. The ability to understand and share the feelings of another. This is one of the most core qualities, tools that any of us can use. And if we don't build it into the way that we go about understanding problems, never mind the solutions, understanding the problem, we will create a solution that has nothing to do with what the real needs of our users are. So a lot of it is about, if you look at, and one of the tools I teach is about root cause analysis, where we might be looking at what are symptoms, right? But what are the real causes of it? So if a symptom is that somebody doesn't have enough food, and that's not really a symptom, but that's a problem. But what's below that? Is it about lack of employment? Is it about food deserts? Is it about not understanding how to prepare healthy foods to best serve your family? What are the root causes? And so starting with empathy, really asking questions, open-ended questions to the extent that you can. Again, given your ability to interface is limited, but as long as somebody has a phone, you can get to them on a phone. FaceTime is a great way, texting, whatever it takes. Get feedback from people. Find out where they're really at with their core problems and how that is affecting them in their everyday life. Next slide, please. So if you were in my classroom, I'd ask you, what does empathy mean and what's an example? So this is a commonly known one, walking a mile in their shoes. Really importantly, to personally experience the customer's perspective. And more than that, seeing what they do, not just what they say. People often are impacted or encased in fear and don't want to tell you what really is going on. They often tell people, whether it's a social worker or somebody who is doing an interview or survey with them, what they think people want to hear, not what the real situation is. And why do they say what they say? If they don't have access to food, why is it that they don't? People often have a lot of shame involved in sharing what their real situations are. So see what they do, not just what they say, because what they say is often going to completely gloss over what the reality is. So it's really, really important to exercise empathy in this process. Next slide. I think you look at this and you'll immediately get it. I don't know how many of you in the room are moms, had children. I had a 10-pound baby. So I can tell you that when I see this picture, I immediately relate to this because it was one tough go of a pregnancy. But The only way to make guys feel empathetic about pregnancy is perhaps be something like this. So is there a way that you can get those who can't directly experience whatever the significant problem or issue is to have some way to more closely relate to it? So this is just a humorous way to do it. Next slide. The most important thing is to get out of the building. And today, getting out of the building might simply be doing a Zoom call, a phone, a text, using WhatsApp, whatever the method is to get to people's direct input. If you can't go out and interview people today, hopefully you can put on a mask and go out and interact and get information from people now, because as things open up. But it's so important not to do it in a vacuum. If you simply talk to your own team, talk to yourself, you're going to come up with something that's not really relevant to the people you're trying to serve. So don't do it in a vacuum. Go out and connect with the population. And then when you come up with a theory, go back and test it with them. Create conversations. Do it in a way that it's iterative and you really get feedback from people. Next slide. This is one of my favorite examples. For anybody who's been involved with the healthcare industry in any way, I've broken a lot of bones in my former life from various sports that I did, so I know MRIs really well, and I had a few instances where I had to take my kids to them as well. And so this story really resonated with me. Doug Dietz was one of the leading engineers in GE Healthcare. He was given the task of creating the most state-of-the-art, the coolest, most feature-rich MRI device for children. And he went to test it at Stanford. He went to Stanford to see how magical his machine was, and he quickly found out that most of the kids that were being walked into the room where the MRI machine was placed were terrified. They needed to be sedated. 80% of them needed to be sedated. They were crying. It was traumatic for the parents, traumatic for the kids, and very hard to provide good medical care when you're having to sedate the kids as well. So he was crushed because he thought that he was delivering the best solution and found out that there was a whole lot more than just creating the best features and functions in a machine. Next slide, please. So I'm going to give you a tool that I think all of you can use. And this is the core tool if you're beginning to do any work in design thinking. And it's called Framing the Design Challenge. And it starts with how might we, not how can we, how should we. How might we opens up a lot of ideas, and it doesn't have judgment, and it's really inviting others to collaborate and brainstorm with you. So the core of Framing the Design Challenge is how might we, fill in the blanks, reimagine, redesign, repurpose, refocus, whatever your work is, in order to achieve something for a specific outcome. So we're going to give you an example. Next slide, please. These are the questions that you would walk through to do Framing the Design Challenge. And this is something I hope all of you will take back to your organizations after this. This is actually one of my favorite exercises to do. What is the problem you're trying to solve? Be super specific, not the solution, the problem. Take a stab at framing it as a design challenge. How might we do something in order to approach it differently? State the impact you're trying to have. So next slide, please. So from the point of view of Doug Dietz, the GE healthcare engineer, he could frame this as the following. How might we redesign the MRI experience for children in order to reduce their fears and need for sedation? So that's what a measurable outcome is. Make it a positive experience for them for better health outcomes. So think about that as you're considering how to reframe, redesign, pivot, and adapt in the services that you're providing. Next slide, please. So to give an example of how that was actually done with Doug Dietz, he went and he did focus groups with kids and with parents and said, what would make the experience different for you? So he got their input. And then next slide, please. He came up with a complete reimagining of the MRI experience. He found out that most kids that have to go for MRIs are oftentimes kids who have been sick for much of their lives. They don't get to go to camp. They don't get to go and do outdoor fun activities. So bring it to them. So he created space camps, and he created Disney character settings. And he created the Adventure Series, which has become one of the most successful offerings of GE Healthcare. Next slide, please. He created a wide variety of experiences. So kids were definitely going from fearful to, wow, this is so cool to be in this. Nurses met them outside of the room where the MRI machine was, often in the parking lot, dressed in Disney characters or space characters, and walked them in. So the kids and their parents actually became excited for this experience. It completely changed the way that GE offered healthcare to young children and created a very new way of GE looking at providing services in healthcare. Next slide, please. So when you are thinking of how do you apply design thinking, and it's really about creating impact. What is viable? What is feasible? And most importantly, what is desirable? Because if people don't want to use it, like the kids that didn't want to go into the MRI machine because they were too afraid, then all the money in the world is not going to make a difference. You need to think about how to start with the user's needs in mind. Next slide, please. This is a fun and perhaps more graphically appealing way to do this. Next slide, please. So we're going back to thinking again about the 5 steps of the design thinking process. For whom are you designing this? What are their needs? For those kids, it was not to be afraid, to be calm, to feel like this was a positive experience. So you could solve it in a way that could engage them and their parents because it made a difference to the ultimate healthcare outcomes. Next slide, please. This is perhaps an even more realistic version of it because you're going to be constantly iterating as you go along in many different ways. Next slide, please. So we all have an idea of what the design process would look like. We take step 1, step 2, step 3, step 4. How many of you actually have a design process that looks like that in anything that you create? It looks a whole lot more like what I'm going to show you next. Next slide, please. The design thinking is very messy. It goes in circles, it turns itself inside out, we get frustrated, we feel like we're not making any progress, and then we might like shoot out of the rocket to the next phase. So it looks either like the top section or even more like the bottom section, constantly reiterating, getting frustrated, trying to move forward, and eventually making progress. But we have progress. We have to be ready for the fact it's a very messy process. Next slide, please. So in the world of COVID-19, it has really impacted us in terms of what priorities and what funding there are. So where before we might have thought about nice to haves, we now need to think about must haves. And so for those of you, I'm sure all of you familiar with Maslow's hierarchy, a lot of the must haves are at the bottom of the pyramid right now. People are worried about shelter, food, security. So many people have lost jobs. So many people are feeling very, very vulnerable for their families, for themselves. So a lot of the funding, in fact, is going to those areas as well. So how do you make sure when you think about how to be relevant and necessary today, how do you make sure that your services and your organizational focus are perceived as necessary and extremely relevant in the world of COVID? Next slide, please. We're going to apply this tool of framing the design challenge to 2 organizations that I know really well because I serve on the board of both of them. I will have full disclosure there and give you examples how they real-time pivoted and adapted in ways that are really, really powerful and relevant. Next slide, please. I don't know how many of you are familiar with Kitchens for Good. I know that they've been very well recognized in the San Diego community. We are about to celebrate our 5th anniversary this September, and they became a social enterprise that was growing very quickly in terms of both the catering revenue and they developed and the number of students they were training, as well as people they were serving. Next slide, please. Kitchens for Good has had 2 primary beneficiaries, and you might call them beneficiaries, clients, users, stakeholders, customers, whatever word you use in your organization. I'll use beneficiary here as people who received the training and the support services. First of all, were people primarily coming out of justice-involved situations and who were trained to become chefs, and transformative opportunity with both knife skills and life skills for the people who are in these, because many of these people have never had a paycheck. They've been in jail much of their lives. They've had very, very trauma-informed lives. And so the chance to go through this culinary job training and then get jobs in the best restaurants, hotels, hospitals, et cetera, in San Diego was transformative for them. The other part we focused on was hunger relief, using what were actually sustainably sourced, rescued food to turn into healthy meals for primarily low-income seniors, as well as for after-school programs for low-income children. Next slide, please. Our customers, and when you're a social enterprise, you think of several different kinds of stakeholders, were for our catering business, we had a $2 million plus catering business. It was in our big celebration hall where we did large events. We had on-site corporate catering. We did private catering as well. That business dried up overnight when COVID hit and we went into shelter in place. Next slide, please. The funders had actually grown over the years, and the question earlier that Outdoor Outreach asked about how do you measure impact, Kitchens for Good from the very beginning measured impact. This slide is actually quite outdated. There are now close to 300 students that have been trained and graduated, and we had a very high percentage of employment. Unfortunately now, because of the restaurants closing, that's changed, but we hope to get back to a higher level on the number of food and then meals that we served. But measuring impact from the outset, that was very, very important and appealing for funders, and was one of the reasons that we continually grew in the funding opportunities that we had. Next slide, please. So COVID hit, what happened? We lost our opportunity to on-site in-person culinary job training, as well as many of the support services disappeared. Our training students were often in substance abuse programs. They were living in various kinds of shelters. They were using a wide variety of mental health services. Much of that either shut down or was only available virtually or on a very limited basis. So a very vulnerable population losing those support services. We lost our annual revenue for catering and events. So what did we do? We pivoted. Next slide, please. So when we lost our catering and events business, but we had this giant space, we had a huge kitchen, we thought, what can we do? So we had to pivot on the spot. We're not able to do our culinary job training. We had to think about life skills. And so what could we do as we saw this problem happening? And one of the biggest problems we saw happening is Kitchens for Good is based in Southeast San Diego, where there's a very high level of job insecurity, very high level of poverty, and schools closed, and there was no school lunch distribution happening in that area. Unemployment was growing. There were more and more people in need of some kind of food to put food on the table for families. Next slide, please. So the question was, how might Kitchens for Good reimagine what we could do? Next slide, please. Again, using this tool, and I'm putting this on here several times because, and I'm assuming they'll share the slide with you. I would hope you go back and use this. So what problem were we trying to solve? How could we frame it as a design question? What impact could we make? What were some possible solutions? Next slide, please. We recognize that in Southeast San Diego, it was hit hard by food insecurity. 40% of the residents there were below the poverty line in Southeast San Diego. All the schools closed. 70% of the children were on free and reduced lunch, no longer had access to food that basically fed them most of the week. Only a few school sites were designated for lunch pickup. And food banks, while they were giving out food, could not meet the growing demand. It had grown exponentially. And the fact that much of the food was also, you have to take it home and prepare it. People didn't even have the means or ability to do that. So how can you feed those people experiencing hunger as the numbers were growing rapidly and really hone in on the uniqueness of the needs in Southeast San Diego in particular, as well as support the San Diego Food Bank as a partner? Next slide, please. So the mission became, how might Kitchens for Good refocus and or redirect their strengths and capabilities in order to expand food production to address food insecurity in San Diego in new and expanded production levels and impact? We were not essentially a mass production site for food insecurity. We did some of that. We had a few meal contracts, but that wasn't the bulk of what we did. We really shifted to have that was what the focus of our students, that be the focus of our organization to address food insecurity. Next slide, please. What we did have was large production capability. We could redirect that. We wanted to have a differentiation because that's part of the solution too, is provide nutritious, prepared, heat and eat, grab and go meals. Expand our partnership with San Diego Food Bank. We had this massive number of volunteers saying, what can we do? So we created socially distanced food production sites in our big celebration hall, which is many thousands of square feet, and set up food production, food assembly sites. Then our students who were at home, not able to engage with us in the kitchen as they usually did, we set up on very short notice online training. We got an organization to help us put meal kits to send to them, which also helped feed their families, send them laptops and other kinds of devices they could use, and also help them connect with resources. So we immediately pivoted to address two key needs we saw: food insecurity and hunger relief in the community, supporting our students on an ongoing basis. And then we said, well, people need to know about this. What can we do to engage in the community? So we created a system called Virtual Dinners for Good that brought the Kitchens for Good experience into people's homes. And I'm going to talk about that a little bit more in a minute. Next page, please. Next slide, please. One of the things I talked about earlier was make sure you tell your story. On your website, talk about what you're doing. Measure the impact. Talk about exactly how many meals you're providing, how many kids you're serving, what you're doing to help the community in as measurable terms as possible. Tell your story and talk about how you've pivoted. The community wants to know, and also funders want to know. It's a great place to make sure that your funders are aware of what you're doing. Next slide, please. So then think about, you have all these stakeholders who want to help you: funders, volunteers, supporters, the community. How can you get them engaged? As we talked about, we had volunteers come in and start with meal prep and meal assembly. And then we created this virtual Dinners for Good. For anybody who'd been to it, we're doing this really fun on-site chef celebrations where we brought chefs in and they did demo cooking, and our students served. And it was really, really a fun way to get the community to be more aware of Kitchens for Good. That all had to go virtual. So every other week, we've had a phenomenal virtual Dinners for Good for the last many weeks. It's brought in new donors, it's brought in new supporters, new awareness. It's been a great way to connect with the community. Next slide, please. So how do we measure that? First of all, how many meals are we serving? We ramped up really quickly, now serving 12 to 15,000 meals a week. That was nowhere near the number that we started out with. We were only at a few thousand early on, and we've ramped up exponentially. We now expect to contribute more than 350,000 meals a year to hunger relief. And by the way, these are not individual meals. These are 4-person grab-and-go meal kits, so you can go home and serve your family. So it's really providing a very different kind of solution than picking up a bag of some fresh produce, maybe some dry noodles, hopefully some meat. We are providing complete nutritional meals. Culinary job training, as I mentioned, has gone online. We actually are having our virtual graduation on Friday. This cohort has really been phenomenal and pivoted themselves to be part of this. We accelerated the opening of a new, larger facility at Salvation Army Doors of Hope, which has been in the works, but now it happened much more quickly. Higher levels of production possible. That will come online hopefully in July. And we have new funding sources because people are seeing what we're doing and we're telling our story and going out and getting new funders. Next slide, please. So I also wanted to share with you another story of another organization I've been involved with. And as you think about how to apply this, I'm going to talk briefly about Free to Thrive, which is an organization that focuses on survivors of human trafficking. Next slide, please. Free to Thrive is an organization that is dedicated to empower survivors of human trafficking to be free and thrive by providing them with legal services, very innovative legal services, and other support. Next slide, please. It's fast growing, it's innovative, and our services have been very multifaceted. It's involved vacatur, which is actually getting rid of completely any record of criminal activity, which is primarily a huge burden on people who are victims of especially sex trafficking, financial needs, family court, et cetera. Very multifaceted, very much wraparound services. A highly vulnerable population that is served, requiring trauma-informed services and support, and always with a lot of in-person touch points, including many of our pro bono attorneys we have go into the jails. Our staff attorneys go into the jails. Our client services people are in jails. They're helping get housing. They are providing many, many touch points. What happens when all that goes away? Next slide, please. This is a quote from Susie Day, who I think is hopefully still on this call. Susie Day is our Director of Development. And she indicated that what Free to Thrive has done since they started was think about what clients need first and foremost. They knew as COVID started that it was going to exacerbate the situation their clients were experiencing because of the vulnerability. One of the biggest concerns is that those who are essentially brought out of human trafficking and who are trying to survive and thrive after being victims of human trafficking for so long will go back to their traffickers, that they're vulnerable. They're vulnerable for financial reasons, for housing, for need for treatment programs. All of that suddenly disappears with COVID. So how can they pivot to be able to really think about how can they best serve their clients given all this vulnerability? That was something they started to think about before quarantine started. Next slide, please. So Free to Thrive had to think, how might we reimagine or redesign our services? How might a smaller, newer, nimble nonprofit meet their clients where they're at, knowing how highly vulnerable their clients are and how significantly COVID would impact them? One of the things they had was a very collaborative team that had already been used to working remotely because they never had one site that everybody lived in or worked in. So they were used to high levels of collaboration and very multidisciplinary kinds of collaboration to meet clients' needs. Next slide, please. So Free to Thrive, literally within weeks of COVID-19 ramping up and quarantine coming in place, put in place a program called STEER, which was launched in early April and became very quickly an empowering opportunity for Free to Thrive's clients. It stands for Survivors of Trafficking Essential Emergency Responses. And what it did, next slide, please, was, next slide, thank you, was provide personalized, holistic, and trauma-informed one-on-one emergency responses. One of the problems of victims of human trafficking is they're so overwhelmed by how many things they need to manage as they're trying to get their lives back on track is, how can I find housing? How can I apply for federal assistance? How can I apply for any kind of income assistance? How can I find food if I need it? How can I protect my kids? They needed to think about all of that. And there's so many moving parts. And as you know, in general, it's hard to find a lot of resources. We needed to provide that hand-holding virtually to make sure that they could remain not a victim of human trafficking, but empowered and a survivor and a thriver. So STEER was launched literally just weeks after shelter in place was mandated. Next slide, please. The number one goal of Free to Thrive with the idea of STEER was to meet their clients where they are at. They could not imagine that their clients would come to them, that their clients could find services on their own. Much of the time, we actually were in jails working with these clients. The courts were closed, so how could they meet their needs right now to make sure that they were not more vulnerable and regressed back to issues that we were trying to help them come out of. So we wanted to find ways we could meet them with personalized service, and tracking and measuring impact from the outset was key. How many people had we served? In what particular areas? Was it financially related, legally related, family court related, housing related, food related? Every single one of those metrics was tracked of how many cases we both addressed and solved. With that, Free to Thrive turned around and applied to the COVID response fund that the San Diego Foundation had put out and applied for a $100,000 grant to get this up and running. One of the big parts of it was why they needed dedicated caseworkers, and we didn't have that. A lot of it was organic and not piecemeal, but it wasn't as organized as what was needed to have this be really, really focused and centered. So as a result of this success from getting the grant, it also gave more confidence to Free to Thrive to be able to reach out, to pivot further, to look for new funding responses, funding opportunities, and reach out and say, this is our story, and this is how we are relevant and necessary today. Next slide, please. Some of the benefits were it enabled them to hire full-time case management, which evolved very quickly from more of a concept and informal approach. And the fact that they hired a full-time case manager then became a catalyst for other funding, which was made apparent by the fact that once you have a full-time case manager on staff, you are qualified for a whole other range of funding opportunities and grants that were never available to us before. So it was like one door opening to the next. It helped them better assess their partnerships. How, in fact, were their partners serving them and they were serving others? And how could we best determine what were the priorities of our partnerships and where we needed to fill in the gaps? Help them better do a good job of telling their story and committing to telling their story. Again, how are we relevant and necessary today? And it enhanced their ability to go out and recruit even more pro bono attorneys who serve as the core of a lot of our legal services, because people saw this story happening and were even more excited and passionate about it. Next slide, please. So given these two case studies, which I've gone through fairly quickly, I apologize, I'm trying to keep within the time frame here. What lessons, ideas, and inspirations can you take away from these examples that might apply to your own organization? Hopefully, as you've seen, two that are really near and dear to home with Free to Thrive and Kitchens for Good, two very different organizations, what the convention center did, what other organizations are doing, it's inspired some ideas from you, for you, of how you might pivot and take these to reframe, to redesign, to repurpose the way that you serve your clients to be even better focused on meeting them where they're at today. Next slide, please. I'd like to open the floor to questions. These are some of the questions that I would encourage you to think about, and also if you want to share them now. How has COVID-19 impacted your organization and the ability to meet your clients' needs? Do you believe you need to adapt and pivot? And if so, how and why? Have you taken some steps to evaluate how to adapt and pivot? Who do you involve in that process? And how can you apply some of these tools as you think about framing the design challenge for reimagining or refocusing how you can best serve your clients today? I will open it up to questions and interaction with the audience. If there aren't any questions, then I'm more than willing to be available for any of you who do have questions or want to share ideas, and I'm happy to give some feedback later. Okay. Well, thank you all. And I am more than happy to be available to anybody who might want to use some of these tools going forward. Next slide, please. I'm giving you some of the tools here so you can use them in your own organizations. This is an example of how you do frame the design challenge. It's a step-by-step approach. Next slide, please. Another tool for this approach, the frame design challenge, how to ask the questions. Next slide, please. Another example. Next slide, please. And here are some resources that are available for free, open source, from both IDEO and the D-School. Just look these names up and you'll come up with a whole library of incredibly valuable tools that you can use on your own at your organization. Again, I'm happy to help. So I encourage you to look these up and see what you can learn to apply to your own needs to pivot and adapt as we go forward. Next slide, please. Again, more tools. The Introduction to Design Thinking Process Guide is great. You can download that for free. Next slide, please. And here's my contact information. Thank you all very much, and I welcome a chance to connect with all of you again later.